Okay, cool.
Welcome everyone to a quick presentation on Westmead Hospital for the Allocation program for first year graduates. I'm Lucy Femin, a current first year grad who will be speaking to you today alongside another physio.
Hi everyone, my name is Kimia Sharifi. I am also one of the physios at Westmead Hospital and I was a first year grad in 2019. So just a quick acknowledgement of country before we start. We're gathered on the custodial lands of the Barra-Madigal mob of the Darug people. This was a place of community, nourishment, learning and life long before the first fleet arrived. As we join together today, let this be a sober moment in which we remember their legacy that lives on today, despite efforts to eliminate it. It lives on through the elders, past and present, and we honour them for it. May we also foster this culture, paying respect to them as we work today.
So the FIG clinical rotations, each rotation goes for about 10 to 11 weeks and you do ICU nights, geriatrics, outpatients, neurosciences, hospital in the home, and Goulburn-based hospital. So we quickly run through these. So in your ICU and respiratory rotation, you'll spend time on the respiratory wards where you'll cover respiratory conditions such as cystic fibrosis, bronchiectasis, COPD, pleural effusions, pneumonia, just to touch on a few. You'll also be working in ICU where you'll see a range of patients from a wide area of specialties. So this may cover teams under trauma, orthopedics, neurosurgery, renal, as well as respiratory. And some of the conditions you may see here are trauma cases, neurological conditions, hypoxic brain injuries, that sort of thing. So it's a really good rotation, getting a lot of acute experience. You then move into nights and relief, where you work 7 days nights, and then you have 3 days off, 3 days working in relief and a day off. During your nights rotation, you spend time working with highly acute patients. Some common conditions are the cystic fibrosis patients, bronchiectasis, patients who have been recently extubated, patients who retain secretions and are unable to clear on their own, as well as preoperative cardiac surgery patients. So this is a really good rotation to get autonomy and be responsible for the patients and your caseload. Geriatrics and the medical wards. So this rotation covers the acute geriatric wards as well as rehab, where you'll get experience treating geriatric patients who are medically unwell, a lot of discharge planning, and then when you're working on the rehab wards, a lot of rehab to get the patients home. So common conditions can be falls, dementia, delirium, chronic pain, a lot of fractures post-fall as well. And then outpatients at Westmead. So this rotation covers any of your outpatient referrals that get referred to Westmead Hospital. You get a range of musculoskeletal injuries, which is really good experience. And then you're also involved in some group classes as well as hydrotherapy.
As part of the neuroscience rotation, you get to do a combination of high dependency and general wards. Generally speaking, you'll get a lot of conditions where, being a trauma hospital, you'll see a lot of trauma cases, and a lot of them you'll start to see from the high dependency ward and then continue their care once they step down to the general ward. You'll also see a lot of patients with neurological conditions, such as Guillain-Barré syndrome, stroke, multiple sclerosis, Parkinson's, or Huntington's disease. You'll also have a lot of neurosurgery patients, so patients post-craniotomy for things such as a brain tumor and hemorrhages. You'll also have the potential of seeing spinal patients. However, they often can be transferred to more spinal specific hospitals, but you do get to be involved in some of their management in the early stages. And you also get a combination of patients who have orthopedic conditions, who may or may not have had a head strike. neuroscience is really interesting because you get to do a lot of early interventions in the really acute phases of the patient's care. You learn a lot about how to apply spinal braces such as CTOs, TLSOs, and LSOs, and learn a lot about spinal precautions and the protocols post-spinal surgery. Hospital in the home. So hospital in the home is otherwise was previously known as post-acute community care. It's a really, really interesting rotation where you're based in the community and you basically drive around to different patients' houses where you provide all different forms of care, whether it be respiratory, rehabilitative for orthopedic patients, or for patients that need improved mobility. You get to work alongside a multidisciplinary team. So you have occupational therapists, nurses, and pharmacists that work with you, and you actually get become like a shared role team where you sometimes have to manage some wound care for the nurses just to save constant visits by all different members of the team. This rotation, you end up learning quite a bit in terms of the overall management of the patient in regards to all the professions. And as part of this rotation as well, you get to be involved in fracture clinic at Westmead Hospital for once a week for about the morning, which is a really, really valuable experience in learning how to plaster, apply cam boots, remove plasters, and it's really, really enjoyable overall. This rotation is predominantly orthopedic based, so you end up seeing a lot of total hip or total knee replacement patients. And lastly, Goulburn. So you generally go to Goulburn in groups of 2. One of you will be based in the inpatients and the other one in the outpatients. The inpatients is predominantly a lot of orthopedic patients where you're getting patients up in the acute setting. So day 1 or day 0 post total knee or total hip replacement. But in saying that though, you also do cover the medical wards and the ICU. You are also involved in the plastering and casting of all the patients that present to the outpatients at the hospital there. For those that do the outpatients at Goulburn, you're basically taking on a various outpatient caseload. You often are following up the orthopedic patients in a group class setting afterwards, and you also get to do some hydrotherapy as part of that rotation. So just moving on to working hours. Working hours are from 8 till 4:30, and that's Monday to Friday. You do 1 weekend shift per month when at Westmead, and for that one shift that you do, you get a day off during the week. When you're on your night rotation, you are working every alternate weekend. So both the Saturday or the Friday, Saturday, and the Sunday night. And then you get the following Friday, Saturday, and Sunday off. If you do rotate to hospital in the home, and when you are at Goulburn, you don't do any weekend shifts, and your hours stay at 8 to 4:30.
So education programs at Westmead. So there's a comprehensive department in-service program that's run weekly, which is really good in learning about different areas. There are other lecture style presentations as well as group discussions. Within your clinical area and your team, you have regular team meetings, which you can bring up any issues you have. You have appraisals at the beginning, mid, and end rotation, where you will sit down with your senior and discuss goals that you have, progressing those goals and how you've achieved those goals throughout the rotation. So that's a really valuable way of learning, and you can get some really good advice on sort of how to move forward and progress your physio career. And you also get sort of throughout that rotation peer mentoring with your seniors, as well as all the level 1-2 physios that are working within that clinical area will be really supportive whilst you're rotating through. As well as this, there are other support mechanisms throughout your year. You'll have be linked up with one mentor who's a senior, who's not involved in your clinical areas throughout the year. So it's really good to be able to have a chat to this person. You maybe meet every few months, and you can discuss anything that's either related clinically or not. So that might be any issues you're having with any seniors that you can bring up to someone. It's good to have someone to speak to in that way, as well as speaking about any professional development that you are wanting to do or have questions about, and then sort of progressing throughout the year, thinking about job opportunities. So having that senior person who's been through all of that and can sit down and have a chat with you is really valuable as well. So the social activities at Westmead, a big aspect of Westmead is Culture Club. So Culture Club celebrate birthdays throughout the year. We always have a Christmas party at the end of the year, which will hopefully go ahead this year despite COVID. And then they also run fundraisers, which is really great to get the whole department involved in, such as recently, or currently doing September. We also have a mental health officers. So it's a sort of a bit of a fun and creative way of looking after staff wellbeing, and they come up with different ideas throughout the year to ensure that we're all on track. And we also have a suggestion box, which is an anonymous way of suggesting anything to improve with the department, whether that be anything from clinical to the social activities aspect of it.
So why Westmead? I guess Westmead has really opened up the doors for me since graduating into such a wide area or areas of physiotherapy. I found that in my new graduate year, I got to see and experience so much, and was put into tricky situations, but always had the support nearby if I needed.
Also, Westmead being such a big teaching hospital, you have so many opportunities to see some really challenging patients. I think a big aspect of what I've really enjoyed is seeing the patients with cystic fibrosis and learning about how to treat them, and being confident in treating them and their condition, which is something that that sort of opportunity you don't get at all hospitals. I guess being at quite a big department and having a lot of the seniors being around for many years, they're really experienced. So I guess you're learning from the best of the best. So it's a really good year where you learn a lot, as well as a fun year within the department and doing different things.
You also have a very big new grad year cohort, figure cohort. So you actually end up bonding really nicely with, I think there's about 10, but also a few from Auburn. So there's quite a big group of you where you have that support from other people going through the same experience as you are, where you can talk to each other and kind of help each other make the most out of the opportunity.
Okay. Thank you.
Thanks.